This is Dr. Hamid Ninalo again with IRDOCNIGERIA. Right now we're about to go do a procedure of uterine fibroid embolization. Again, as you know, uterine fibroid embolization involves using minimally invasive techniques to put catheters and wires into the vessels that feed the fibroids to block up vessels that are feeding the capillary network of the fibroids, and essentially we make an ischemic environment, which means an environment where the fibroids have no oxygen supply and they essentially shrink away and melt away in the patient. Our patient today is a 36-year-old female who's battled heavy uterine bleeding for about 12 years. MRI showed multiple fibroids, and we already know that compared to some other surgical techniques apart from hysterectomy, we're able to treat every single fibroid in that uterus by getting into the arterial capillaries of those fibroids and embolizing them. We're going to go start the process in a minute, and it's going to be a journey with you today.
At this time, the table is being prepped and we have all our materials ready on the table. We're about to start the process of uterine fibroid embolization. As you see, all of the materials are minimally invasive with catheters and wires, and there'll be blades for cutting.
We're now in the preparatory phase of the uterine fibroid embolization procedure with my partner here, Sonny, my assistant, who's helping me get the wires and catheters ready for the procedure. The patient's already prepped and draped. We're now getting all our materials ready, and once the material is ready, we'll go ahead and do a timeout to verify who the patient is, if this is the correct procedure, and then begin. Into the common femoral artery, which is an artery in the groin that connects to every artery in the human body. From this access in the artery, we could essentially get to anywhere we want to within the body, and really that needle is the only hole we make in the body for the entire procedure. At this point, we have access into the common femoral artery, and what we're doing now is inserting the wire and catheter into the artery. From the common femoral artery, we have the ability to get into any artery in the human body. As interventional radiologists, we have the advantage of having a background in diagnostic radiology, so we're specially trained to look for vessels in the body, in the human body, or get anywhere within the human body and be able. So what you're going to see on the screen at this point is that we're now advancing the microcatheter deep into that uterine artery so that we make sure that our embolic agent is only going into the uterine artery, which is the artery that we plan to treat, and nowhere else in the body. There's a lot of myths out there about non-target embolization with uterine fibroid embolization, but when done with the right hands, again, as you see, the microcatheter goes directly into the uterine artery, and shortly you're going to see an arteriogram deep within the uterine artery showing that we're only within the uterus. It's well deep within the uterine artery with a microcatheter in there, and we're going to show that in a minute with an arteriogram showing that we're only within the artery that feeds the uterus and nothing else before we start embolizing. And now we're ready to embolize. Okay, deep within the uterine artery, which of course is the artery of interest, and what we're doing is putting in these particles, and what you're seeing me do here with my hands is mixing the particles, and we mix the particles into small pieces, and then we basically inject them. And if you look on the screen here, you see the particle is going into that uterine artery, and in this case, this uterine artery is actually starting to slow down, so we're going to be done on this side in a minute. We're about 10 minutes into the entire procedure now, and we've treated the left side, and very soon we're going to go into the right uterine artery to also treat that, and we should be done. Hopefully we should be done with this case in about 30 minutes or less.